Oh, hello. Now I know what you must be thinking. Why am I doing this? Why am I smoking? Why am I addicted to something that is so detrimental to my health? But unfortunately, the reality is a lot of us still are. Now, in today's episode, in Health Matters, what we'll be looking at is not cigarettes, but what cigarettes can do to you. Yes, I'm talking about lung cancer. Now, lung cancer is one of the most prevalent cancers in Malaysian men, and maybe it's time for them to take a look at their habits and maybe put down the cigarette. So join me in today's episode. This is Health Matters with me, Dishen Kumar. Hi, welcome. This is Health Matters with me, Dishen Kumar. And earlier, I was actually talking about today's topic, which is lung cancer. And it's something that I think all of us know about, and it's also a very big issue in Malaysia, especially for men. So joining me today is Dr. Toh Laiman, who is the consultant clinical oncologist and also the Vice President of the Lung Cancer Network Malaysia. Thank you, Doctor, for joining us today.
Thank you, Dishen. Thank you for having me.
Okay, let's start off with a very generic question, which is on everybody's mind. What actually classifies as a lung cancer?
So, lung cancer denotes any cancer where the cell of origin or the place where it first starts is in the lung or the airway itself. Sometimes when you have cancers in other parts of the body, they may metastasize to the lung. For example, from the colon, it travels in the bloodstream and deposits in the lung. That is not classified as lung cancer.
Okay.
So lung cancer is purely cancers which arise in the lung.
Okay. Now, talking about, is there any difference? Because is it treated very differently if it actually metastasizes somewhere else and comes to your lungs, or compared to when it actually metastasizes in the lungs as well?
Yes, so that's an excellent point, and it matters greatly because the treatment that we direct towards the tumor cells depend on where it originates. So the chemotherapy drug or targeted therapy drug that we use for colon cancer will still be for colon cancer even if it's in the lung.
Okay.
But conversely, if it starts in the lung, we need to have a different set of drugs for that particular tumor.
Okay, all right. So there are different types of lung cancer. Can we talk about that, the different types of lung cancer?
The different types of lung cancer are, broadly speaking, non-small cell lung cancer and small cell lung cancer.
Okay.
Non-small cell being about 85 to 90%, small cell 10 to 15%. Again, it boils down to what these tumors look like under a microscope.
Okay.
So that's how we denote which sort of cancer they are.
Okay. And talking about how rare is non-small cell compared to small cell cancer in Malaysia?
The incidence of non-small cell versus small cell in Malaysia is quite reflective of what's happening in the rest of the world. Non-small cell is probably more common because the cells that produce lung cancer in the lung are more predominant compared to the cells from which small cell lung cancer arises from.
So let's move on, Doctor, into who can actually get cancer. Are all of us exposed to lung cancer? Can anybody get it?
So lung cancer, the most common cause of lung cancer is probably due to smoking, so environmental exposure to a carcinogen that's found in cigarette smoking. But increasingly, probably about 30 to 40 of my patients that come through my clinic with lung cancer were never smokers or even light smokers. So that's quite interesting, and that seems to be reflected in global statistics as well. In terms of inheritance, so for most famously the Angelina Jolie story, which is she inherited a gene called BRCA. For lung cancer, there doesn't seem to be that genetic link with an inherited disposition. But of course, our research may not have caught up with all the spectrum of genetic associations there may be.
Okay. And can non-smokers, like you were saying about non-smokers getting lung cancer, do we know why?
We don't really know why exactly, but there has been some interesting research that has been published which may point towards certain factors.
Okay.
For example, there was a big study in Singapore and then subsequently in the States, which looked at the risk of cancer among women who walked fried.
Oh,
Yes.
wow. Okay.
So not only the chemicals that are produced through the wok frying, but also the resultant meat in which was wok fried and they consumed. And they found that these chemicals that were found in the bodies of these patients could potentially lead to lung cancer. So that could be one association. I mean, certainly we are exposed to environmental toxins that we may not be able to account for. People who anecdotally, groups of people who live next to factories, live next to certain plants have developed lung cancer, but it's quite difficult, as you can probably appreciate, to really pinpoint the exact environmental response, the chemical that was responsible.
Okay, talking about that, because you've always heard these stories, especially when you want to ask someone to quit smoking, because smoking actually causes one of the main causes of lung cancer. They always say, like, I had an uncle who smoked for 60 years but nothing happened to him. And then we hear about people who've been doing it for 5 years and suddenly they get lung cancer. So is there a genetic influence in that?
Funny, a lot of my patients have that same uncle.
Right.
Whenever I tell them to stop smoking. So again, it probably boils down to the patient's susceptibility to a particular environmental toxin. That person who, I'm sure there are many people who have been exposed to cigarette smoking but yet don't develop lung cancer. Those people probably genetically, inherently are more resistant to developing DNA damage, whereas some people are more susceptible. But the thing is, we can't pick out who's who. So as from a medical viewpoint, of course, the less you smoke or even quitting smoking altogether is the best prevention strategy.
So even quitting smoking actually reduces your risk greatly in where the actual body can actually stop polluting your body, as you say.
That's absolutely right. So when you, even though you smoke for 10, 20 years, the moment you stop smoking and stop smoking totally, your risk reduces. So that may be something in that our body is able to repair or even prevent the occurrence of cancer.
Do a lot of your patients, after being diagnosed, is there a lot of regret in that?
There is some sort of regret, but yet the emotional response to a diagnosis can be quite varied. There is regret, there is anger, there is denial, disbelief. I think it's not easy to get hit with a diagnosis of lung cancer.
Okay, all right. Thank you so much, doctor. We'll actually be right back after this, talking more about lung cancer. Maybe we'll go into treatments and also clinical trials. This is Health Matters with me, Dishen Kumar. We'll be back after this. Alright, welcome back. This is Health Matters with me, Dishen Kumar. Today's topic has been lung cancer, and we had a very interesting discussion with Dr. Toh Laiman, the consultant clinical oncologist and also the Vice President of Lung Cancer Network Malaysia. Doctor, very interesting conversation we've had so far. Let's move on into how is lung cancer diagnosed, or what are the symptoms that patients actually go through before coming to see you?
The symptoms of lung cancer can be a cough, pain in the chest region, a coughing up of blood, loss of weight. But the symptoms I've just mentioned actually can be confused with very day-to-day
it's actually very general
conditions. So there isn't one particular symptom that differentiates it out from a chest infection or tuberculosis and so forth. Perhaps the only thing that may be slightly different is that there are symptoms which don't go away with treatment. So for example, you've been to the GP once or twice for courses of antibiotics and the symptoms persist, then I think it's probably time to get an X-ray done or see a specialist.
So when a patient comes in saying that they have the symptoms, what are the type of procedures that you guys do?
Probably the most common procedure that is done is an X-ray to detect any changes in the lung. However, X-ray is not the best way to pick up lung cancer. You probably need a CT scan. I think that would be the best way.
Okay.
Yeah.
And if a patient gets one CT scan, you actually already know if they have developed
a CT scan can probably pick up about 90 to 95% of lung cancers.
Oh, wow, okay.
In fact, there are certain countries which have run screening programs using CT scans or low-dose CT scans to detect lung cancer before they become symptomatic, before the patients develop symptoms.
Okay.
So they've targeted patients who've had a long-standing history of smoking, and they've done CT scans, and they've managed to pick up lung cancers before the patients develop symptoms.
Okay.
The caveat to that is a lot of people required to be screened, and it's a huge resource implication for the countries involved.
So this was happened in which country?
There was one trial run in Europe and one trial run in the States.
Can we see it happening in Malaysia?
Both the results have been published. In Malaysia, I think we face certain challenges. One is the resource implications of actually doing the CT scans, and the second would be the CT scans will probably pick up quite a lot of changes in the lung which are not related to lung cancer.
So not all changes in the lung is lung cancer, correct?
No.
Okay. Now, when we want to move on into, after the patient has gone through that and we actually diagnose them to have lung cancer, what is the next step?
Okay, so the first step, as I said, would be to see where the tumor is, and that's a CT scan, or sometimes a PET scan we use. The next is to get some tissue from the actual tumor to try and work out whether this is non-small cell or small cell, and within non-small cell, what subtype of non-small cell lung cancer it is. So that will involve a biopsy. A biopsy is either done externally, so you insert a needle into the lung to remove some of the tissue, or internally, so a lung specialist would put a scope down into the lung to access some of that tissue.
Okay.
So once we've worked that out, we also need to stage the patient carefully. That means to make sure that the tumor, or to define the location of the tumor within the body.
Okay.
So that will involve an MRI scan of the brain to scan the brain, and also a CT scan or a PET scan, preferably, of the body.
Okay. Now, talking about that staging, how many stages of cancer are there, and which stage where you actually, if you get that stage, there's no turning back?
Okay. So
I'm sorry to be so morbid about it, but we have to talk about that. Yeah.
Sure, I think. So cancer is divided into 4 stages, and that's the same across the board,
Okay.
whether it be lung, colon, or breast. So stage 1 is generally when the tumor is quite relatively small and just located in one region. Stage 2, when the tumor is bigger or has spread to some of the lymph nodes near the middle of the chest or the heart. Stage 3 is when the tumor is quite big and has spread to quite a number of lymph nodes. And stage 4 is when it's spread outside of the lung area and into other parts of the body, for example, the liver, the bone, or the brain.
Okay.
So from stage 1 to stage 3, our aim of treatment is still curative. That means we're delivering treatment with intensity in order to get rid of the tumor permanently. For stage 4, what we're trying to do is to control the tumor for as long as possible, but we don't tend to use the word cure in that setting.
Okay, all right. Thank you, Doctor, so much. I think we'll talk more about this. We'll go for a short break. This is Health Matters with me, Dishen Kumar, and today's episode we're talking about lung cancer. We'll be back right after this. Welcome back. This is Health Matters with me, Dishen Kumar, and today's topic is lung cancer, and with me is Dr. To. So, Dr. To, we had a very interesting conversation. We have switched our location now because we're going to go into very serious discussion. First of all, I think question on even my mind when I talk about lung cancer is the mortality rate.
Right.
how is the mortality rate, or if a person gets lung cancer, what are the chances they can survive?
So it's not good news.
Okay.
Lung cancer compared to other types of cancer has the worst survival rate in Malaysian statistics. So lung cancer, 1 out of every 4 cancer deaths in Malaysia is caused by lung cancer. Lung cancer kills more people than breast, colon, and prostate cancer combined.
Wow.
So that's the bad news. The good news is we have many more exciting and new breakthroughs in terms of treatments that I'm sure we'll talk about.
Okay, so talking about treatment, what are the types of treatments that is there currently, and any new treatments out there now?
So the type of treatment for lung cancer depends on our genetic analysis of the tumor. So in terms of the previous ways we've looked at it, we've not tended to look at the genetics. Now it is absolutely essential. So when we do the biopsy for the patients, we look at what genetic components are in the tumors. So we can give them either smart bombs or targeted therapies, treatments which just hone down and kill the tumor cells. And for stage 4 patients, we used to expect survival rates of about 6 months, we now can get survival rates for about 2 to 5 years,
wow,
or even longer.
Yeah, that's a huge increase. Oh,
the longest patient I've had on targeted therapy is 8 years.
8 years,
And
wow.
this is a huge difference from 20 years ago, which was just 6 months.
Oh, wow, okay.
The other exciting breakthrough in lung cancer is, of course, immunotherapy.
All right.
So immunotherapy is a drug that's designed to boost our immune system so that our own immune system can start fighting the cancer cells and kill these cancer cells. Again, we are seeing patients who have had very long-lasting and excellent responses to immunotherapy in stage 4. And the latest way we are doing it is combining this immunotherapy with chemotherapy to boost the effect, and we've seen excellent results with that as well.
So not only treating the patient with chemotherapy, but also using immunotherapy as a double whammy, as they can say.
So you're actually modifying our immune system such that our immune system can now detect the cancer cells when they emerge and kill them. So this is like what we say, sending a sniper into the jungle, letting him hide there, and wherever enemy emerges, just shooting him off. So that slow burn kill of the cancer cells.
Okay, so it's not all bad news for people who have lung cancer.
Yeah.
But talking about the stage 1 to stage 4, are there different types of treatments, or is it very targeted in stage 4, or is it very targeted in stage 1, or things like that?
So unfortunately, most of the patients in Malaysia, about 3/4 are diagnosed at stage 3B or 4, which is not curable. So what of the treatments I've spoken to you about are targeted towards that group. Only a minority, 20 to 25%, when they first see us, are what we consider curable. So if it's stage 1 or 2, surgery tends to be the mainstay of our treatment. So to go in actually removing it. If the surgeon can't remove it, then we give it radiotherapy to blast it away. And that is also what we do in stage 3. We use radiotherapy plus immunotherapy and chemotherapy with an aim to cure the patient.
Okay. Now talking about stage 1 and stage 2, something interesting that I've even talked about when I go out and do all these shows, talking to doctors and things like that about cancer, is there isn't a sure way of telling someone that the cancer may not come back.
Yes.
There's always a chance for cancer to come back. So about when a person gets cancer, maybe stage 1 and stage 2, especially lung cancer, is there a lot of lifestyle changes that they have to do? Because you can quit smoking, yes, but is there other steps that they can take, not only in the quit smoking, they actually can increase their chances not to actually get cancer?
So I think once you're diagnosed with cancer, you automatically go onto a follow-up program. So where we doctors will do scans regularly to check you up for at least 5 years. So once you're over that 5 years, we tend to use the word cure, or at least say that you're in remission.
Okay.
It is absolutely imperative to change your lifestyle once you have a diagnosis of cancer. And what has been proven to be effective is to stop smoking, to lead a healthy lifestyle, which includes a healthy diet, exercise, sleep well, less stress, and so on and so forth, mainly to make sure your immune system is strong, so that these cancer cells that come up can be killed by your own immune system.
Okay. Now, they've done all that. For a person who is going through treatment, it's chemotherapy, immunotherapy, you're saying. Is there any side effects for that treatment as such?
Yes, I think every treatment potentially may incur some side effects. But I think with modern cancer treatment, we tend to limit these side effects to the absolute minimal. So chemotherapy today, for example, is not the same as chemotherapy as it was 10, 20 years ago, where you had hair loss, vomiting, you couldn't get out of your house. Patients undergoing chemotherapy these days actually, after 2-3 days, get back to work, go out, look after their families. The treatments are designed to allow patients to carry on life as normal as possible. What we know is immunotherapy, which seems to be more effective than chemotherapy in many circumstances, have even less side effects. And patients are even much better in terms of how they feel, and they're able to carry on with their day-to-day life.
So immunotherapy, you're talking about there's less side effects, but what are the side effects that a patient may experience if they do immunotherapy?
So patients on immunotherapy may experience a little bit of tiredness, and that's quite common, but that's bearable. Perhaps the one thing that that patients on immunotherapy are at risk of is, in fact, we improve the immune system to such a high extent that our immune system is so strong that it may start to attack some of your own cells in your own body.
Oh, wow.
So for example, the lung or the liver and so forth. But the good thing is if we detect it early, we are able to suppress that down with medications, and patients are normally quite okay after that.
Okay. So doctor, I have to ask you, put you on the spot here a bit. We've talked about lung cancer, we've talked about it's one of the most common cancer in Malaysia for men, and smoking is one of the main causes of it. What would be your advice for people watching this right now? They might be watching this even with a cigarette in their hand.
Okay.
What would be your advice for smokers in Malaysia?
My advice is put that cigarette down, get out, breathe some fresh air, exercise, eat well, more vegetables, less fried stuff and healthy stuff.
Okay. Do you have anything you have to say about people who think they need to check with their doctors, or they're having some symptoms and things like that?
I think if you have symptoms that what we talked about earlier, coughing or coughing out of blood, unexplained weight loss, pain in the chest, which is again unexplained, that doesn't go away with a simple treatment like antibiotics, definitely go and get it checked out with your specialist or your GP to explain your concerns. And I think most probably you'll need some investigations like a chest x-ray. Early detection is always the best. There's a cure for lung cancer, and people live long if we manage to detect them early and cure them.
All right. Thank you so much, doctor, for your time. Now, that has been Health Matters. This is today's episode. We talked about lung cancer, we talked about smoking, we talked about what these guys can do to you. And one thing that I can take away from this episode is maybe it's time to quit. This is Health Matters. I'll see you in the next episode. Goodbye.